Welcome back to the channel. Today is March 6, 2026, and we are diving into a massive day for medical science. From AI blood tests that catch liver disease years early to a potential new switch for cancer-fighting T-cells, we have a lot to cover. Let's get into the top stories shaping the future of healthcare. Breakthrough, AI-driven liquid biopsies. The news: researchers have unveiled a new AI-driven liquid biopsy that can detect silent liver diseases, such as early fibrosis and cirrhosis, years before symptoms appear. How it works: the system scans patterns in fragments of DNA circulating in the blood, known as fragmentomics, to identify chronic disease signals. Why it matters: conditions like cirrhosis often go unnoticed until the damage is irreversible. This technology could shift liver care from reactive to preventative on a global scale. Oncology update: reviving exhausted T-cells. The discovery: a major study published today identifies a genetic switch that can revive exhausted cancer-fighting T-cells. The problem: in many advanced cancers, the immune system's killer T-cells become worn out and stop attacking the tumor. The fix: scientists uncover the genetic rules that determine whether these cells stay active or burn out. This discovery is expected to supercharge the next generation of CAR T-cell therapy, particularly for tough-to-treat solid tumors. Pharmacy and regulatory: GLP-1 expansion and policy. New findings: new research suggests that GLP-1 medications like Ozempic and Wegovy may help the heart recover more effectively after a heart attack. Policy update: in India, the Union Health Ministry informed Parliament today that fee structures for medical colleges remain a state-level decision, though guidelines to cap 50% of private seats under the National Medical Commission are currently sub judice, pending in court. Global context: this follows a tumultuous year for the FDA, which saw significant staffing changes under new leadership but still managed to approve 46 novel drugs in the past year. Public health and rapid-fire research. Malaria breakthrough: researchers identified a protein called ARC1 that malaria parasites cannot live without. This opens a brand new target for anti-malarial drugs. Rare disease tech: a new AI system can now detect acromegaly, a rare hormone disorder, simply by analyzing a photo of a patient's hand. Nutrition alert: a sweeping study released this week linked higher pesticide levels in the body to the consumption of specific fruits like strawberries, urging consumers to prioritize thorough washing or organic options when possible. Medical negligence: a major ruling today from the National Consumer Dispute Redressal Commission highlighted a clear case of medical negligence in a 2010 brain surgery, awarding 10 lakh rupees in damages and reminding the industry of the critical need for pre-op CT scans. The future: bioimplantable gels. The tech: scientists at ETH Zurich have created a laser-printed hydrogel implant that mimics natural bone. Impact: unlike rigid metal implants, this jelly-like material supports natural bone repair and could transform how surgeons treat severe breaks that currently require complex grafts. Quick shorts. Myth: BMI is always accurate. Body mass index, BMI, is widely used, but it has limitations. It doesn't account for muscle mass, bone density, or body composition. Athletes with high muscle mass may have a high BMI without being overweight. Conversely, older adults might have a normal BMI despite having less muscle and more fat. Other measurements, like waist circumference, can provide additional insights. WebMD. Nearly 1 in 4 adults over 40 lives with the daily discomfort of osteoarthritis, a condition that gradually wears down the cartilage cushioning the joints. Once that cartilage is damaged, there is no way to restore it. For many patients, treatment becomes a long road of pain medication, eventually leading to joint replacement surgery. A study published in The Lancet Rheumatology on August 12, 2025 suggests there may be another option: gait retraining. Researchers from the University of Utah, New York University, and Stanford University found that adjusting the angle of the foot while walking can significantly reduce pain, also slowing cartilage deterioration in the knee. The findings come from a year-long randomized controlled trial. Futura Sciences. The recurring theme today is clearly AI, not just for data, but for life-saving early detection. Which of these breakthroughs do you think will have the biggest impact? Let me know in the comments. Don't forget to like and subscribe for your daily dose of science. Stay healthy, and I'll see you in the next one. A quick disclaimer: this video is for informational purposes only and does not constitute medical advice.